Hi there, this is Dr. Kingston, and in this video we're going to be talking about the pineal gland. Our learning objectives here are pretty straightforward. We're going to describe the pineal gland, find its location, and talk a little bit about its endocrine function. So the pineal gland is a singular midline structure that can be found in the posterior aspect of the diencephalon. All right, so we talked before about the hypothalamus and the pituitary gland here, and our pineal gland is going to be posterior to that, so this little knob that sticks out here. It is superior, just superior to the posterior commissure, where we have right and left fibers crossing, and to our midbrain, and specifically the superior and inferior colliculi. Its job is to produce a hormone called melatonin in response to low levels of light striking the retinas of the eye. Melatonin regulates circadian rhythms, so your sleep-wake cycles. A lot of melatonin makes you feel tired, and a little bit makes you feel a lot more awake. And I would love to tell you that there is a nice direct pathway from the retinas to the pineal gland, but there just isn't. So, in fact, it takes possibly the most convoluted route possible. So let's take a walk through here. Number one, we've got light coming in and striking the retinas. Boom! Okay? That is going to take a short little hop through some fibers in the brain, not important which, back to the hypothalamus. Okay? Hypothalamus is our integration center for most of our sensory coming in, right? So from the hypothalamus, then, it's going to pass down into the spinal cord, and specifically, it's going to pass down into the intermediolateral horn of the spinal cord, which, if you remember your neuro, is where the sympathetic nerves hang out. Okay, so the first of the two sympathetic neuron chain. Okay, so it goes down into that IML column, and it is going to exit again and synapse at the superior cervical ganglion. Okay, so we've gone from light to some special sensory, down into the spinal cord, and to sympathetics. So now we've come all the way back out here. We synapse in the sympathetic chain at the superior cervical ganglion, and from there we ride with the rest of the sympathetic nerves back up to the head and access the pineal gland that way. That is the craziest loop in all of endocrinology. I'm sorry, this isn't endocrinology. We're just talking about the endocrine system. So please take care to appreciate the many steps involved here, and rest assured that this is the most difficult pathway you're going to have to know. All right, and that brings us to the end. I will see you next time.